Associated Press. Go ahead.
Thank you. Governor, your April 16th order that banned social gatherings in northeastern Iowa had a clause that barred local officials from closing businesses that they believe are unsafe for workers. It gave that power to the Iowa Department of Public Health. Why should the state and not local officials be in charge of those decisions? And should you have acted sooner related to the Tyson plant in Waterloo?
Well, first of all along, we've been basing our decisions based on data that's been provided. We have worked extensively with the Iowa Department of Public Health and their epidemiology team in conjunction with the CDC, and each one, the epidemiology team, the Department of Public Health, CDC, have worked in consultation with their counterparts in states all across this country. This is an unprecedented virus. This is evolving on a daily basis. Every day we learn something new. Every day we have more access to testing, to different types of testing, to high throughput testing, to addressing some of the PPE issues, and making sure that we're doing everything that we can to protect the health and safety of Iowans. So we could probably there's always more we could have done, but I think we've been tried to be very proactive. We've tried to reach out to the businesses and to the long-term care facilities and to do everything that we could to not only protect the most vulnerable, but to make sure that we were protecting our healthcare workers, our first responders, those essential workers that are on the front lines. The way that we really put the RMCCs in place and took a regional approach to make sure that we could be prepared in case we did see a surge in cases, so we wouldn't overwhelm and collapse our healthcare systems. We are demonstrating, I believe, on a daily basis, based on what Iowans have done and how they have been responsive, that we are in really good shape when it comes to beds and ICU beds and ventilators. And that's a reflection of Iowans listening and listening and applying the mitigation efforts that we put in place. And hopefully that has flattened the curve. It has reduced overwhelming our healthcare system. It's bought us time so that we can continue to increase the PPE supply. We're seeing more and more of that come online. And so every day we're making significant advances, I believe, in addressing COVID-19, and to the point where we're going to start talking about how we can open things up in this state based on what we've been able to do and based on what we've put in place. And so I know Iowans are ready for that. We'll do it in a responsible and safe manner, but we are looking at how we can start that process.